Headaches is one of the most common of all neurological complaints. About 90% of the population suffers from headaches at one point or another. And how you define headache can certainly have an impact on the workup and treatment. Some people have a condition called migraine, which is a very different condition than, for example, a condition called temporal arteritis or something like trigeminal neuralgia. Patients don't typically come in knowing that they have a migraine or knowing the cause of their headache. All they know is how they feel, and what they want from us is they want to feel better. So they'll come in complaining of pain in their head or a headache, and we have to find out what's causing that, whether it's a migraine or whether it's something like a brain tumor, trigeminal neuralgia, a temporal arteritis, a tooth abscess, or what have you. Headaches are quite common. The prevalence of headache is approximately 90% in the population. So in any given population of people, 90% of them have headaches. So it's typically a younger female in their teens or 20s. That's the stereotypical patient, although any patient, any race, gender, or age patient can get a headache, and the causes of headaches are typically quite different. In, for example, an older patient that comes in with new onset headache, it's not typically going to be a migraine, but in a younger patient, particularly female that comes in with new onset headaches like age 18, that's typically just migraine. Patients have chronic untreated headaches. They can have what's called long-term potentiation in their brainstem, and it can lead to a condition called chronic daily headache, which is very hard to treat, and the headaches typically don't get that much better. And so when headaches are untreated, it is thought that the mechanisms that transmit pain in the brainstem can become strengthened or potentiated in a way that they can develop a condition called chronic daily headache, which is very refractory and difficult to cure. In terms of lifestyle factors that contribute to headache, it's well known that certain lifestyles can contribute to headache. For example, when patients get poor sleep, that can cause headaches. Certain foods are well known for contributing to headaches in some patients, such as wines, cheeses, chocolate. And so it's important for each patient to keep a headache diary where they keep track of when they're having their headaches and what the circumstances are surrounding the headache, so they can look for patterns, and we can look for things in their lifestyle that are contributing to their headaches. The best way to help someone that you know who struggles with headaches is to get them seen by a board-certified neurologist. Make sure that they get an appropriate workup to rule out dangerous causes of their headache, because the headache they're struggling with, it might not be a migraine. And so it's important for them to be seen by a professional and get an appropriate workup, and then get an appropriate treatment plan in place that works for them and that's safe, does not cause side effects. So I would say the best thing you can do for any friend or family member struggling with headaches is get them to see a board-certified neurologist.